When a patient can't tell you that they're in pain, feeling sick, or just not right, early signs of infection can easily be missed. That's why recognizing subtle changes is one of the most important parts of caregiving for nonverbal or cognitively impaired individuals. Infections can progress quickly, especially in older adults or those with chronic illnesses. Something as simple as a urinary tract infection or an upper respiratory infection can lead to hospitalizations or even sepsis if it's not caught early. Because these patients may not be able to describe their symptoms, behavior and body changes often speak louder than words. Caregivers should pay close attention to changes in behavior or mental status. Sudden confusion, agitation, or restlessness may appear, or the patient may become more withdrawn, sleepy, or unresponsive. Refusing meals, turning away from caregivers, or no longer participating in usual activities are also common early warning signs that something is wrong. Vital signs can offer important clues as well. Watch for fever, chills, or sweating, but keep in mind that some older or frail patients may actually have lower than normal body temperatures during infection. An increased heart rate, faster breathing, or a drop in blood pressure can also indicate infection even before a fever develops. Changes in the skin or overall appearance should never be overlooked. Look for flushed or pale skin, sweating, or cool, clammy skin. Redness, warmth, swelling, or drainage around wounds, catheter sites, or pressure areas are signs that infection may be developing locally. Alterations in urine and bowel patterns are another common indicator. Urine that is darker, cloudy, or has a strong odor may signal a urinary tract infection. Increased frequency, incontinence, or new confusion accompanying these changes should be reported. Likewise, constipation or diarrhea that is new or worsening can also point to an infection or a medication side effect. Appetite and general condition can change rapidly during illness. If the patient begins refusing food or fluids, if they have nausea or vomiting, if they cough while eating, or if they seem weaker or more fatigued than usual, these could all be signs of infection. As a caregiver, you know your patient's normal behavior and routines better than anyone. If you find yourself saying they just don't seem like themselves, that intuition is very valuable. Document what you see, when it started, and how it has changed. Even small details like a new cough, less appetite, or agitation can help nurses or healthcare providers determine what's going on. When in doubt, it's always better to report than to wait. Recognizing infection early can prevent hospitalization and save lives. For patients who can't speak for themselves, your eyes and your intuition are their voice. Notice changes, document carefully, and report concerns promptly. You are the first line of defense in keeping them safe and healthy.